a 44-year-old patient of ours just delivered a beautiful, healthy baby, and she had gone through a real difficult time before we did mini IVF, going through massive stimulation. She came from the other side of the country, far away. But originally, when she was only 42 years old, she had massive stimulation with 27 eggs, 15 fertilizations, and she went through pre-implantation genetic diagnosis, and they diagnosed no normal embryos. It's really very difficult to believe, but nothing was normal, and all those embryos out of her 27 eggs and 15 fertilizations, all those embryos were discarded. So then she went to that program again, and they again stimulated her very heavily, received 21 eggs, 15 were fertilized, and she had pre-implantation genetic diagnosis again. And this time, out of those 15 fertilizations, coming out of a total of 48 eggs, she had one embryo diagnosed as normal. That embryo was transferred to her with high hopes, and she didn't get pregnant at all. So the effort to stimulate in a huge way to get massive numbers of eggs in a 43-year-old or 44-year-old woman, and then to do genetic diagnosis, seems to be flawed. You don't get normal embryos. You'd think out of 48 eggs, there should have been a normal embryo. In fact, there was an embryo diagnosed as normal. Clearly wasn't, because she didn't get pregnant. So then she came to us, and we did mini IVF, minimal stimulation, just with Clomid. And we wound up with 6 day 3 embryos and 4 blastocysts. We've already transferred the blastocysts, and she got pregnant and delivered a healthy baby at 44 years of age. And so that's very exciting, because clearly she didn't need a huge amount of stimulation. And she didn't even need pre-implantation genetic diagnosis, PGD. In fact, PGD, by all accounts, could have easily lowered the pregnancy rate in these older women. Clearly, a normal PGD doesn't mean you're going to have a baby, and clearly an abnormal PGD doesn't mean the embryo is truly abnormal, because there's error built into the whole process. So minimal stimulation to get the most perfect embryos you can get from the best quality eggs is a better way to deal with the older woman's eggs than to try to massively hyperstimulate her.